So in terms of the existing agreement, there will be a 1-year extension on offer to the 30th of June. Just reiterating, same services and funding, no new services and no new funding. And noting that the one-off funding that was applied for this year ends on the 30th of June and won't be renewed for those contract holders going forward. The other thing is those that are staying on the existing agreement can swap to the new agreement at any time. The other element in this is all new pharmacies wanting a new agreement will have to go onto the new form, and anyone who's changing ownership will also have to go onto the new agreement. The old agreement will not be available for anyone changing ownership or starting up a new business. So this is a bit of a table comparing the existing agreement to the new integrated agreement, and as you can see, it's got a ticker across whether they're available in the new agreement. So same services and fee structure as the current CPSA, so that applies to both. The new agreement has that framework for change control and a process for consulting on the development of new services and funding models going forward. That is not a component of the existing agreement. There'll be new investment through the new agreement, which won't be available in the existing agreement. And new services will be developed through the new agreement and not the existing. The new agreement's evergreen, which we see as a real positive. When you talk to PHOs in the aged care sector, they really appreciate having an evergreen agreement because they're not worried about the funding going forward. They can actually focus the discussions on how do we develop their ability to deliver new models of care and respond to their patients and their community needs going forward. The existing agreement will have an expiry of 30 June 2019. So it'll be a 1-year extension only. So in terms of going forward, we've started the consultation process, which goes through to the 10th of April. And all the feedback will be summarised and published on the TAS website in April. And the final contracts will be announced in early May, around that time. And then the offer will come out in May as well to all existing contract holders. 1 July is when we anticipate the 2 new agreements will come into effect. And as I said before, from 1 July, anyone changing ownership or setting up a new business will only have an opportunity to sign up to the new agreement. And those that remain on the existing agreement can transfer at any time that they so desire around that. So we would like to invite everyone on our journey to change the way we deliver community pharmacy, how we engage with other stakeholders in the sector and our communities and our patients to develop new services. We do want to see pharmacy at the forefront of leading innovation in the sector. As Carolyn said, we've got a young, vibrant community pharmacy workforce, and we want to make the use of all of their skills. So you can go to that website there and share your thoughts to us. There'll be consultation meetings happening all around the country, so feel free to attend those at any time and any of those that you want to. So a couple of other points around this. So this is about one size doesn't fit all. If we're going to deal with that equity issue that Carolyn raised, we can't expect to just carry on the way we are. When you've got a health disparity of Maori dying 8 years earlier on average than a Pākehā person, it's unacceptable from a health perspective and from a societal perspective. And we're wanting to address those issues, and we're wanting pharmacy to be part of that and pharmacists to be part of that to help us to address those issues that we're facing. So we're looking for a more flexible contract, and we want this to deliver on the New Zealand Health Strategy and the Pharmacy Action Plan, and we think this is a very exciting opportunity for the sector and the DHBs, and with all the other providers in the sector to actually come up with a fantastic new way of delivering services to patients in the community.